Some new data shows the infant mortality rate in South Carolina dipped, while meanwhile across the country they saw an increase. And the CDC says that there was a 7% drop in deaths from 2021 to 2022, which were the most recent numbers.
While that sounds encouraging, the state is still 12th in the country when it comes to infant deaths. So much more work needs to be done to improve this situation. News 19's Cassidy Beyer has the story.
COVID-19 really meant less access to care, which meant, less preventative care, like obstetric prenatal care, but it also just led to acuity. So it led to sicker moms and sicker babies.
Following the pandemic and nationwide shutdowns, the U.S. saw infant mortality rates increase 3% back-to-back years for the first time since 2001. South Carolina, however, saw otherwise, with a 7% decrease. Maternal and Child Health Care Project Leader at USC's Institute for Families and Society, Sarah Garreau, tells News 19 although she's grateful for the decrease, it's extremely minor.
20 counties, or 43% of the state, that is either a desert or in the highest level of maternal vulnerability. And when we look at access to care in the last decade, we've actually lost 12 labor and delivery units.
Areas with lack of good healthcare access, referred to as deserts, have few resources. When they do find a doctor, it's often one that lacks expertise.
More moms don't have a reliable prenatal care provider because the hospital systems now often are related to the outpatient practices, right? They're a system of care. More moms are going to be born in the emergency department or a rural health clinic where providers may not be fully trained or be able to handle those severe crises that might occur.
Helping with barriers to care, the South Carolina Birth Outcomes Initiative is relaunching efforts later this week, trying to further decrease infant mortality and help mothers through community and hospital interventions. It's similar to an effort in 2021 when providers came together to look at how postpartum care can be a preventative measure to infant mortality, since many deaths happen within the first year of a child's life.
We knew that we had pretty low rates of women receiving their needed postpartum visit. And that committee and task force, called the South Carolina Postpartum Learning Collaborative, they worked together with the state Medicaid agency to extend access to Medicaid benefits for the first year after having a baby.
Therefore, although the decrease is not as significant as Garreau would like, there is something to be hopeful for in South Carolina come 2023. Cassidy Beyer, News 19, WLTX.
Well, Garreau says her best advice for moms is not to ignore any sort of abnormal or painful symptoms that they might be having. Speak up. Whether the baby stops kicking or they might feel something abnormal in pregnancy, try your best to meet with your healthcare provider and speak about any concerns you might have. And in a study done by DHEC during 2021, they looked at the leading cause of death for babies. Now, birth defects topped the list with 203. Second was low birth weight, followed by maternal complications, and then SIDS, or sudden infant death syndrome, and also accidents.